Hi, it's Jeanette, the nurse educator for Parkside OB. Let's learn a little bit more about hemoglobinopathies and the updated ACOG recommendations of universal carrier screening as part of standard prenatal care. We'll also discuss how your insurance coverage may impact your decision to follow these guidelines. Our red blood cells are round and donut shaped, and hemoglobin is the part of that cell that carries oxygen molecules throughout the body. So this round shape for the red blood cells is really important. This allows a high number of cells to flow with ease through our blood vessels. They bump together like bumper cars, but they don't get stuck. And this helps to prevent traffic jams from cells sticking together, especially in small vessels like capillaries and tiny venules. Now that we know a little bit more about hemoglobin, a hemoglobinopathy is a genetic disorder that affects hemoglobin and the shape of the blood cell itself. Abnormal hemoglobin may not be able to carry as many oxygen molecules, and the abnormal shape can lead to blood cells sticking together or getting caught up in the various twists and turns in our blood vessels. And all of this impacts the amount of oxygen blood can effectively carry to our different organs and tissues throughout the body. Let's talk about a couple of different examples. First, let's talk about sickle cell disease. This disorder results in red blood cells taking on a curved crescent shape, also known as a sickle, as you can see in this picture. This type of cell can't carry as much oxygen, and it's also very prone to sticking together and can cause serious problems with blood circulation like blood clots. And another example is thalassemias. These are genetic disorders that affect either the alpha or beta part of the hemoglobin. So you have alpha thalassemia and beta thalassemia. This reduces the amount of oxygen the cell can transport. These can range in severity, and sometimes people have no symptoms at all. Those with severe symptoms, though, can have significant health problems, and treatment all depends on the severity of the anemia. Until recently, carrier screening was determined by a person's race or ethnicity, but ACOG has determined that is no longer the standard of care and has changed their clinical recommendations to provide better care for all patients. And knowing if you're a genetic carrier for these disorders is important. If you're found to have a trait for sickle cell or one of the thalassemias, then it would be recommended that your partner also be tested to better evaluate the risk to your unborn baby. And if you're found to be a carrier, your providers will walk through the entire process with you. Ultimately, the clinical recommendation can be summed up as universal screening. But what does that mean? This means that anyone who is pregnant or has plans to become pregnant should be screened to determine if they are genetic carriers of these hemoglobinopathies. And it means regardless of a person's identified or presumed race or ethnicity, that they are recommended to receive this carrier screening. Although ACOG has updated clinical recommendations, not all insurance companies determine coverage based on this. And what we have found is that there are several insurance plans that do not deem the screening as medically necessary and are rejecting the claim, leaving patients responsible for the bill. It's really important to call your insurance carrier to verify if your current insurance plan covers this screening. And previously, this was drawn as part of the first prenatal labs at a patient's first visit. And we want you to be able to make a well-informed decision, especially since we know now that some insurance plans are not covering this. So now we're going to be offering this at the 16-week prenatal visit, and it can be drawn at the same time as the maternal serum AFP screening that's offered at that visit as well. So it's encouraged, strongly encouraged, for you to call for verification of coverage prior to coming to that 16-week appointment. And while our providers really urge our patients to have the standard of care determined by ACOG, we do want you to know that if your insurance plan does not cover this carrier screening, then you may choose to opt out of this if you feel you can't pay the expected out-of-pocket expenses. If you'd like to learn more about hemoglobinopathies and the clinical recommendations for them, ACOG has a great patient-friendly education site that uses plain language, and it's also very easy to navigate. If you scan this QR code here, it'll take you to that website so you can read some more about it. Thank you so much for taking the time to learn more about the importance of screening for these genetic disorders. Please remember this is general information, and it's intended to help our Parkside OB-GYN patients make informed decisions. It's not meant to replace any advice or guidance given by a provider.